Hi everyone, I'm Megan, and this is my senior practicum project presentation. I currently work at Claremont Regional Medical Center on a monitored telemetry 43-bed progressive coronary care unit that takes care of patients with a wide variety of cardiovascular issues. I chose to do my senior practicum project on promoting venous thromboembolism prevention through sequential compression device compliance. I chose to do this, my senior practicum project on this, because I noticed that oftentimes when physicians order SCDs for patients on the unit, they never end up wearing them. The goal of my senior practicum project was to develop a learning plan that would increase the unit's knowledge on VTE risk factors, and as also increase SCD compliance. I wanted to start my presentation by just doing a brief review of VTEs and SCDs. I know we're all nurses and we know what VTEs are. I just wanted to share this because before I did this project, I did not realize that deep vein thrombosis and pulmonary embolism were two subcategories of VTEs. So I thought that was interesting. VTE is very important to discuss as nurses for several reasons. The first and foremost being that, according to the Center for Disease Control, it is the #1 reason of preventable hospital death in the United States. Each year, VTE affects as many as 900,000 people and results in 100,000 premature deaths. Healthcare associated costs related to VTE are upwards of $10 billion a year, and as many as 50% of blood clots are healthcare associated. As many as 70% of healthcare associated VTEs could have been prevented had proper VTE prevention measures been implemented. VTE is the 5th most frequent reason for unplanned hospital readmission. And VTE is such an important topic because more and more people in the United States are developing and living with risk factors that increase their risk of VTE. So sequential compression devices are boot-like devices that use intermittent pneumatic compression to provide a massage-like motion that simulates walking and promotes blood return to the heart from lower extremities. It's a form of mechanical VTE prophylaxis, and they provide approximately 45 millimeters of mercury pressure at the ankles and 35 at the knees. SCDs are beneficial for a variety of reasons. They have few clinically important side effects. They can be utilized in patients who are at a high risk for bleed and are not candidates for pharmacological VTE prevention, such as Lovenox or heparin. They're also more effective than just using thromboembolic deterrent stockings alone, or what we call TEDHOs. Multiple studies have shown that SCDs are an effective VTE prevention measure. A meta-analysis that analyzed 70 clinical trials involving over 16,000 patients found that using intermittent pneumatic compression was more effective than using no ICP in reducing the instances of VTE. Researchers also found that intermittent pneumatic compression appeared to be as effective as pharmacological prophylaxis in VTE prevention. When pharmacological thromboprophylaxis was used in conjunction with intermittent pneumatic compression, the risk of DVT was even further reduced. So I began my project by tracking sequential compression device compliance on my unit before giving my unit presentation and in-service. I did this in order to be able to assess for any improvement in SCD compliance after. So I tracked SCD compliance on my unit for 5 shifts prior to conducting an SCD in-service and presentation for the unit. So this is the data that I compiled, and as you can see, the total compliance or total average compliance percentage ended up only being 14.5%. I felt this compliance rate was really low, and I wanted to look into potential reasons that could be contributing to low SCD compliance on the unit. So I had this idea to develop just this quick 2-question survey and send it out to all the nurses on the unit. And in this survey, I asked them 2 questions. The first being, do you check for SCD orders on each of your patients during your shift? And second, what do you feel is the most common reason that SCDs are not placed on patients? So this survey allowed me 21 nurses on my unit responded, and only 66.7% of these nurses said they actually check for SCD orders on their patients. So there's one reason for low compliance. The next question, I gave them a comment box and let them put what they thought contributed the most to noncompliance. And I got a total of 4 different answers from 21 different nurses. And those included patient refusal, nursing judgment, not seeing the SCD order in the electronic health record, and failure of the SCDs to be reapplied following ambulation and patient care. So patient refusal was the number 1 reason identified by nurses on the unit for SCD noncompliance, and nursing judgment was the second most common. So nurses cited fall risk, frequent ambulation, and pharmacological VTE prevention already being ordered as the reason that they chose to use their nursing judgment to leave SCDs off the patient. So although this was cited as like the second most common reason, it's important to note that it is out of the scope of practice for nurses to use nursing judgment to leave SCDs off. If there is a concern about safety or appropriateness for SCDs for a patient, the proper channel would be to go to the physician and get the order discontinued if it's truly not an appropriate order. It is out of the scope of practice for nurses to just leave them off. This is not a nursing judgment issue. Other nurses, I think just 4 nurses total cited not seeing the SCD order in the EHR, and then 2 nurses said that cited failure of SCDs to be reapplied as the reason that they thought SCDs were most often left off. So discovering that my unit had an average SCD compliance rate of only 14.5%, and that nurses are purposefully leaving SCDs off of patients they don't feel they are appropriate for, allowed me to tailor my unit presentation to address these issues and hopefully influence some positive change. I developed a presentation in PowerPoint that covered these topics and delivered it to my unit. So I included learning objectives, VTEs, why VTE is important to address, risk factors for VTE, what SCDs are, responsibility and scope of practice for the ordering and placing of SCDs, how to properly apply SCDs, contraindications for their use, and proper documentation of SCDs per hospital policy. I then recorded the PowerPoint presentation and uploaded it to YouTube. A link to the presentation was sent to my unit via email, and I also posted it on my unit's Facebook page. The nurse manager really liked the presentation, so she also had me print it out and post it on the bulletin board in our break room. I also developed a short in-service that I could present to my unit during our daily safety huddle to promote SCD compliance. I created a 1-page quick reference guide on SCDs that included instructions on how to properly apply SCDs on a patient, how to measure a patient's leg for SCD sleeves, and required documentation per hospital policy for SCDs. And this is the guide that I sent out. So in order to assess the effectiveness of the presentation, I created a learning assessment using SurveyMonkey and provided a link to the survey to all nurses on the unit. The mean score of the learning assessment was 95%, and it had 10 questions, and the highest score was 100 and the lowest score was 73. The learning assessment questions showed that the presentation was highly effective in educating the unit on VTE, the use of SCDs in the prevention of VTE, and hospital policy concerning the use of SCDs. So I only worked 3 shifts after my in-services and presentation were done, so I was only able to track SCD compliance on 3 shifts before the presentation was due. But I did analyze the data, and after the in-service and unit presentation, SCD compliance on my unit increased from 14.5 to 20%. So while a 20% compliance rate is still very low and we still need a lot of improvement on the unit, I feel that a 6.5 increase in compliance is pretty good in just a couple weeks. So I definitely feel I met my goal in improving SCD compliance on my unit by doing this project. This concludes my presentation. Thank you everybody for watching.